Freedom come by struggle. Freedom come by struggle, by struggle. Freedom come.
The protest by angry members of resident doctors UBTH temporarily disrupted traffic along some roads within the hospital complex to draw the attention of the federal government to some of the demands of the National Association of Resident Doctors, which include implementation of white paper on residency training program, full implementation of National Health Act 2014, payment of full salaries of all members of National Association of Resident Doctors, implementation of appropriate entry steps for house officers, among others. Spokesman for the protesters and president of the Association of Resident Doctors UBTH Branch, Dr. Oseghale Eustace, said that the demands of the association will only help to improve the health sector in Nigeria owing to obsolete medical facilities.
Very unhappy with the state of affairs as it concerns health in the country. We have a situation where there is a hurried outflux of doctors out of this country. What other people term brain drain. Doctors are leaving this country in their hundreds daily. For example, now in the whole of Edo State, no single MRI machine, magnetic resonance imaging machine. Patients have to travel to Ondo State to a private facilities to use MRI. You can imagine the stress on the patient traveling to Ondo State and traveling back to Edo State.
Dr. Oseghale said the situation of the medical profession in Nigeria is such that no doctor wants to remain in the country to practice, as many of them, including professors, now put in for professional medical examinations in Western countries to enable them practice abroad.
We have a situation where you're operating a patient, your light source goes off. You have to defer that case. The light source used was procured in the 70s. We are eager for the facilities to function. All we want is these facilities to function. And we also don't want our colleagues and us having to run away from this country. Doctors have to go into all sorts in South Africa and Ghana just to feed, because they cannot stand the austerity in this country. We have a situation where doctors have not been paid for 5-6 months in this country. We feel it's unfair.
The protesting doctors appealed to the federal government to meet their demands to avoid strike by resident doctors. Aigboje Ikhuoria reporting.